This learning module addresses lifting-related risk factors for low back injury. When it comes to lifting-related back injury, there are two types of lifting issues. The first is ergonomics. What are you lifting? The second is body mechanics. How are you lifting it? The first is lifting ergonomics. What are you lifting? And the list of risk factors to address is long, and it goes beyond how heavy is the load. The weight being lifted is, of course, obvious. But the other question is, how often do you need to lift it? How low is the lift? How high is the lift? Do you have to twist with the load? How far away from your body are you holding the load? And finally, how effective is the grip to hold onto the load? Heavy loads are an obvious risk. Sometimes we can reduce the weight that we have to lift if humans have to lift it by hand. But that is just one ergonomics tactic. The other approach is to remove human lifting and instead use mechanical equipment to lift it. Not so obvious are light loads that are lifted frequently. How many times a day is it lifted? Seeking to reduce how often you lift, even light loads, becomes important. Ideal lifting height is belly button height. Lifting lower than waist height risks injury to the discs, ligaments, and muscles. The lower you lift, the worse the risk. Lifting higher than waist height risks injury to the lumbar facet joints. The higher the lift, the worse the risk. So we seek to modify the job to reduce how low you must lift and to reduce how high you must lift. Twisting with a load can sprain spinal joints and injure discs, so we seek to reduce the arc twisted by changing where the load starts and where it ends during the lift. Moving a load that is away from your body, even by just a few inches, can greatly magnify the load placed on your spine, even light loads. So we seek to keep the load and where it must be moved very close to your body. And finally, how good is the grip on the load? A padded non-slip surface with a grip diameter of about 2 to 3 inches is ideal. A wide, flat, somewhat slippery surface will increase injury risks, as would a very small grip surface. An ergonomics approach seeks to reduce, even by a little bit, as many of these risks as we can. Often, small improvements can prevent very serious injuries. So after considering what we are lifting, we must now consider how we are lifting it, our personal body mechanics, our lifting technique. Our primary concern is to reduce forward bending with a load. As we discussed earlier in our back injury prevention lesson, forward bending at the lower back shifts spinal weight bearing from the joints and back of the disc to the front of the discs. This tends to push the jelly nucleus of the disc backward against the back wall of the disc. This back wall is often weak and may cause a disc bulge or even a disc herniation. Forward bending can place a risky stretch on ligaments at the back of the spine. This is where back sprains may occur. Forward bending also shuts off the lower back muscles that protect the ligaments, joints, and discs, making back injury more likely. So we generally want to minimize loading the spine in a forward bent position. Our basic approach to safer lifting technique is to load the spine in its normal position of a slight inward curve. This loads the spine with the muscles in their strongest positions. The facet joints are properly aligned, the ligaments are on a slight slack to avoid sprain, and the discs are loaded with the jelly nucleus in the middle, slightly forward part of the disc, where it is less likely to cause a bulge or herniation. This is considered the most stable loading position at the lower back. So to make this happen, the worker should lift with the feet wide, about shoulder width, get very close to the load, tuck your chin in and lift your chest up to create a normal arch in the lower back, and squat to bring in the thighs and buttocks to execute the lift. Some research suggests that it is even better to use some variety of lifting methods through the workday, such as switching between bending versus squatting. But if the load is heavy, we still suspect that our squatting with a bit of arch in the lower back is better. Here is our list of safer lifting technique. First, stop and think. Be conscious, be aware, and reminded that you must protect yourself from lifting injury. This conscious reminder to be aware can reduce your risk all by itself. Pre-position your feet to reduce twisting at the lower back with a load. If you are moving the load to your left, then turn your left foot out toward that direction. This reduces twisting at the lower back as well as at your knee. Keep your feet placed wide to keep your balance stable. Keep the load close. Actively brace your spine. By squatting at the knees and hips, tuck your chin in and arch your back slightly as you tighten your belly and buttocks to lock your spine in its normal curved position. These are our recommended rules for lifting a load that is at or below waist height. However, these rules change slightly if the load is at chest height or higher. Here, the load is shifted more toward the facet joints along the back of the spine. You can protect these joints by actively tightening your gut. Increasing abdominal belly pressure tends to reduce the load placed on these delicate facet joints. So to summarize how to reduce lifting-related back injury, we use two general strategies: improving ergonomic demands of lifting and improving how we perform the lift. Seek to reduce the weight lifted, how often we must lift it, how low we lift, how high we lift, how far away from the load we may be lifting, how much we must twist with the load, and how good is our grip on the load. We seek to lift with good technique, such as getting close to the load, bending the knees and the hips, tuck the chin and arch your back in slightly, keep your stance wide, pre-position your feet to reduce twisting, and tighten your belly, especially on a high lift.